Can you see me?
Yes, perfect. Now we can see you.
Okay, perfect. Okay, so today we are talking about sleep regressions, ages you should know about. When you hear the word sleep regression, right away we're thinking, oh goodness, my baby's going to be up all the time. They're going to be up from naps. Their naps are going to be inconsistent. Bedtime sleep's going to be interrupted. But I want you to think progression, not regression. So what's happening is your baby is progressing and growing during the sleep regressions. So this progression and growth may happen mentally or physically, and this is distracting her from sleep. Okay, so many people refer to this as a sleep regression. And us as adults, what do we need to fall asleep? We need the right physical conditions. We need it to be dark. We need it to be quiet. We want to be able to relax ourselves into sleep. So we find simple routines and cues that tell our brains that it's time for sleep. We find our favorite position, and that helps us shut down the brain. We want to do the same thing and kind of prepare the same thing for our babies and toddlers. When your baby is able to fall asleep independently on their own, sleep regressions are a little bit more easier because they do have those self-soothing skills and they're not relying on you to help them fall asleep. Okay, so distractions lead to disruptions in sleep, also known as sleep regression. So as your baby is growing physically, she might be getting teeth, or she might be gaining core strength. She might be learning to walk. She might be learning to roll over. These are things that can distract your baby from sleeping. Her brain is busy. This will manifest into a sleep regression. This can cause shorter naps. She can take longer to fall asleep, and sometimes she'll have night wakings, or sometimes she'll even have early morning wake ups, those 5 a.m. wake ups. This can all happen during sleep regressions. One of the biggest sleep regressions is the 4-month sleep regression. This can happen anywhere between 3.5 months and 5.5 months. It doesn't always happen right at that 4-month mark. It can happen a little early. It can happen a little bit late. So what's happening is your little one is exiting that 4th trimester and waking up to the new world around her. So she's progressing mentally and learning object permanence. This is the term for the fact that you exist even though she can't see you. Okay. I often speak to parents who are 3 months with 3 months old that was sleeping with a 3-month-old that was sleeping 6 to 8 hours stretches at night, and now they're waking up every 3 hours. And often naps, 1 and 2 hour naps, are becoming 45-minute naps in length during this regression. What's happening is your baby's going from baby sleep, newborn sleep, to more adult-like sleep, and they may be having trouble connecting their sleep cycles, which is why they're waking up at that 45-minute mark. You probably hear the term 45-minute intruder a lot, and that's what's happening there. They're having trouble connecting their sleep cycles, and their sleep cycles change around that 45-minute mark. Okay. So does the 4-month sleep regression end? It does. For some people, night wakings can recede. They'll stick around until they decide to make changes in the way their little ones fall asleep, also known as sleep training, sleep teaching, as I like to call it. So this, at 4 months old, this is a great time to teach your baby those independent sleep skills. Sometimes we can do it during the regression. It kind of helps us get through the regression because we are teaching them to fall asleep independently on their own while they're in the 4-month sleep regression. It is possible. There's also sleep regression between 5 and 8 months. It seems like these sleep regressions never end. And if you aren't following the Wonder Years, or if you haven't read the book, I do highly recommend it. It just tells us a little bit about mental leaps, when to expect them, and what to expect during these leaps. Okay. some people there's no evidence that really proves that Wonder Weeks is accurate, but it is a place of comfort for moms to know what to expect and what's going on developmentally with your baby. There's so many changes that happen during that first year of life. There's rolling, there's hovering on all fours, there's pulling up, there's standing. Sleep regressions relate to motor development, okay? And this can often manifest into being awake in their crib, trying to practice these skills. I like to have an independent sleeper who can put themselves to sleep at bedtime. And then during these stages, when they're going through this sleep regression, they're not hit as hard with it. Let me see. So there is also a 9-month sleep regression. So there's often bedtime resistance around this 9-month mark. Many parents report that babies are more clingy to them at 9 months old. I recall my little guy wanting to be around me more at 9 months. Right now, he's totally daddy's. He's like all about daddy. So the 9-month sleep regression is associated with separation anxiety. What can we do if your baby's more clingy? You definitely want to give your baby more attention. Take deep breaths and be patient, because it can be very frustrating if your baby's always wanting you and not wanting daddy or not wanting grandma or anyone else. So just try to be patient, take a few breaths, take an adult timeout, I like to call them, if you can or when you can. If your baby does rely on you to fall asleep, it may take you longer to get through these regressions or progressions, because she's protesting you leaving, and she's relying on you more to fall asleep. So our next regression we're going to talk about is the 12-month regression. So around this time is when they're going to be getting their first year molars. Again, this can vary from child to child. For those children who get their molars around the 12-year mark, the 12-year sleep regression could hit. Common signs of the 12-month sleep regression are they were once napping fine, and all of a sudden they're having nap resistance and bedtime resistance. Some parents see some night wakings where there previously were no night wakings. Okay. I feel like I hear somebody talking or trying to talk here. Okay. Anyway, let's move on. So there's also a regression between 12 and 18 months. Okay, 12 and 18 months is a big range. I use that loosely because there's some changes that happen during this time. Often there's bedtime resistance and more night wakings. This is when toddlers, pretty much at this age, toddlers develop fear of missing out. So they are having fear of missing out, and they're wanting to test boundaries. So you may see that your 18-month-old is pushing the boundaries and resisting bedtime a little bit more. Toddlers are generally impulsive at this age. They want it because they want it. And sometimes there's just no reasoning with them. Who can blame them? It's our job to respond to our little person's feelings with compassion and acknowledgement, but it doesn't necessarily mean that they get to nap in our arms because they feel like it when they were previously napping fabulously in their crib. So you do want to expect some resistance to missing out on activities to take a nap. This is totally normal between 12 and 14 months. Okay. So next we're going to talk about the 22 to 24 month range. Around this time is when our regression or progression involves a burst of language. So your kid may go through a language burst where they're able to express themselves more at 22 to 24 months. Often a sleep regression at this stage manifests as your baby being awake but content in the middle of the night. So they could wake up in the middle of the night and just be babbling or talking to themselves. It can also mean that your baby is resistant to go to sleep at bedtime and for naps. Okay. Also around this time is they're going to have more molars. They're going to have their 2-year-old molars. So you could see a sleep regression happen here. You may often see them putting their fingers in their mouth at bedtime, and they may also have some 5 a.m. early morning wake-ups. Okay, so our next sleep regression is happening around 2.5 years old. This one's mostly happening for nap resistance. A lot of times at this age, parents they jump the gun and move their kid to a toddler bed, and we don't want to do this. Toddlers do not develop the understanding and impulse control until closer to 3 or after. They don't understand the boundaries and the expectations that we instill for them to stay in their bedroom and in their bed. So keep them in the crib until 3 or after. Very, very important. Sometimes parents their child will go through the 2.5-year sleep regression, and they think, oh, well, it can't get worse. Let's put them in a toddler bed. And it backfires. It may go well for the first few nights or maybe the first week, but it ends up backfiring in the long run because they don't understand. They don't have the impulse control to understand their boundaries, to stay in the bed and to stay in their bedroom. And you're going to be playing whack-a-mole all night where you're taking them back to bed. And if you have multiple children, you're going to be attending to the 2.5-year-old and to the baby, and it's just a continuous cycle. I just worked with a client who went through this. She had a 2.5-year-old and she had a 6-month-old, and it was like one would wake up, one would finally fall asleep and the other would wake up, and we were calling it whack-a-mole because she'd go attend to the 2.5-year-old, but then as soon as he got to sleep, the 6-month-old was waking up. So we got everything straightened out for that client. But yes, nap resistance can be present at 2.5 years old. They don't want to miss out on the world. Many parents take this as a sign to drop the nap as well, but don't be fooled because most kids don't drop their nap until 3 to 4 years of age. So just be patient, just stay consistent, and it will pass. The regression will pass. Okay, so I know sleep regressions can be overwhelming. There's so much that changes in your kiddo's life in the first few years. So it's normal that sleep will be disrupted. So often parents report 2 weeks of amazing sleep before they see the sleep regression hit, and then it takes a week or two to get them back on track. So just so you all know, I do offer my services through the ParentGood app. I'm just going to take a minute quickly to tell you a little bit about myself. Okay, so my name is Erin again, and I am a pediatric sleep consultant. I work with babies from newborn to 3 years old. I became a pediatric sleep consultant because after I had my son, I was so uncertain on how to get this little guy to sleep through the night. I was trying all the things. I read all the books. People were telling me sleep when baby sleeps, nap when baby naps, but he just wasn't sleeping or napping long enough for me to fall asleep. So I started working with a pediatric sleep consultant so I could learn the everyday important task of sleep. And through working with the consultant, my little guy at 5 months old was sleeping 11 hours through the night without waking up uninterrupted, and he was taking longer naps during the day. I got a fun, loving, energetic child, and I also got my husband back. We were at the point where we were both exhausted from taking turns getting up with the baby. And once we taught, my son's name is Quade, once we taught Quade to sleep through the night, we had time. He was in bed at 7 o'clock, so we had time to have a late dinner, watch a Netflix show, have a glass of wine, and that just really meant a lot to me and to our marriage. Also, I just wanted to say there are a lot of sleep consultants out there, and one thing that makes me a little bit different is I don't subscribe any singular theory, method, or book. I have studied pediatric sleep. I've read all the books. I've tried all the things, and there are a million ways to approach sleep. And I believe that each family has unique needs, and each child has unique needs. So I like to take the time to get to know you and your family, and I like to get to know what your goals are for your child, because every child and every family story is a little bit different. Okay, so my goal is to improve your child's sleep and to provide you with the knowledge to do this so that you're confident and comfortable. Okay. So with my services, what I do is, with your help, I develop an individualized step-by-step plan that will have your little one sleeping through the night in no time. Every child is different, and every parent's values on how they approach sleep are different. So the plan is customized with your personal values and needs taken into account so that you and your child are comfortable. So that's just a little bit about me and my services. If you would like to set up a consultation, you can set up a free consultation through the ParentGood app. I'd be happy to talk to you. Do you guys have any questions about sleep regression or any other sleep questions? We'll go ahead and start the Q&A now. I think I did see a question come in through the chat. Okay, so my son won't sleep unless someone, is cut off a little bit here. Does that say my son won't sleep unless someone is in the room with him and he's 3? So what I think you need to work on here is 3 is a good, it's okay to sleep train at 3. You're going to see a little bit more resistance because they now do have a lot more say in things. You want to have a solid bedtime routine. You want to make sure you do the same steps every day at bedtime. This is going to help signal him that it's time for sleep. So a good idea of a bedtime routine would be your bath, read about 3 books, sing a song, say your prayers, lights out, sound machine on, walk out the room. Okay, so that's a good idea of a solid bedtime routine. You can do the same thing for nap, except for you're just going to not do the bath. But bedtime routine should take about 15 to 30 minutes, and your nap time routine should take 5 to 10 minutes. Is he still napping? He could also be overtired at that point. I would work on some sleep training with him. There are multiple methods out there to, depending on your family values and your child's temperament, that also takes a huge role in which sleep training method I pick for my clients. If you tell me your child is laid back, then we know we can use a gentler approach. If your child is very strong-willed, we might need to use a more aggressive approach. Okay, so Carrie, if you would like to set up a consultation so I can learn a little bit more about your situation, a couple things I'd like to know is if he's always slept with someone in the room with him, or if this is something that's new. Is he in a toddler bed, or is he in a crib? Bunch of questions I have for you, Carrie. Okay, so Lena, my son had a sleep training, but I think going through a sleep regression, and no, he doesn't sleep on his own. He's 9 months old. Okay, yep, he could be going through a sleep regression at 9 months old. So you want to try to get him sleeping on his own. You want to stick with your sleep training method. Even through regressions, you always want to fall back to your sleep training method. Okay, so whatever method you were using to sleep train him, you're going to go back and use that sleep training method through the regression. The last thing you want to do is bring in new sleep props or sleep crutches during these regressions. Meaning, if he's resisting nap, you don't want to start rocking him to sleep to get the nap in. You just want to try to push through and do your sleep training until through the regression. Okay. Same thing with bedtime. If he's resisting bedtime, make sure that that he's not overtired, that your wake windows are age appropriate, and sleep train through, and make sure that he is falling asleep on his own. Okay, sleep train until he's falling asleep on his own. Okay, any other questions?
Thank you, Erin, for being here today. Guys, if you have any questions, you're welcome to stay for a couple of minutes and ask our expert, Erin. It could be any question related to sleep training or sleep regression. Otherwise, see you next Wednesday. Next Wednesday, we're going to talk about how to dealing with eating obstacles, picky eaters. So you're more than welcome to stay and ask more questions, or we'll see you next week. Thank you, everyone, for being here. Thank you, Erin.
Thank you. Christina, do you talk about sleep issues with 11-year-olds? I do not work with 11-year-olds, but I can check with some of the other some of the other ParentGood experts to see if there is someone else that is trained or is qualified to work with 11-year-olds. I'm just going to make a note. Hadar, maybe you know if there's somebody, a ParentGood expert that does work with 11-year-olds.
I think we have experts that can help Christina with that as well. I need to look it up, but Christina, can you write me here in the chat your maybe your full name or your email, one of those two, so I can know how to reach you later. Thank you.
Okay, and Fong has a question. My son wakes up in the middle of the night screaming and throwing a tantrum. I can't see how old he is. I don't know why, but my screen cuts off the side of the chat. Do you have any tips? So depending on his age, it could be, he could be overtired. Sometimes if a child is overtired, it'll cause middle of the night wake-ups. You also want to make sure, oh, he's 2.5. Okay, so you want to make sure he's falling asleep independently on his own. You also want to make sure, again, that your bedtime routine is solid. You're doing the same thing every time. You want to make sure he's not going to bed too late. 2.5, I like to see bedtime about 7:30. And I do like to see a nap in the middle of the day, about 2 to 3 hours. You want to make sure that he's not getting too much daytime sleep. I like to see 11 to 12 hours at night with a 2 to 3 hour nap for a 2.5-year-old. So an example of a schedule for a 2.5-year-old would be 7 p.m. bedtime, 7 a.m. wake up time, nap time from 12 to 2 or 1 to 3. Do not let him sleep later than 3, or he will not have enough sleep pressure to fall asleep at 8 or 7 p.m. As far as the screaming and tantrums at night, could be due to so many reasons. You want to make sure that his room is dark. Maybe have a small nightlight or a flashlight in there for him. Is he in a bed, or is he in a toddler bed or a crib? He should still be in a crib, preferably. You want to make sure he has comfort items in there. Teddy bear, favorite stuffed animal, favorite teddy bear if he has. Any other questions? You're welcome. Feel free to shoot me a message in chat if you have any other questions, or if you would like to set up a call, you can do so as well through the app. Okay, I am going to go ahead and end the session unless anyone has any other questions. You can either unmute yourself or ask away. Okay, again, it was nice chatting with you all. Have a great night.